As protesters continue to demand reform on racial bias in policing, a study sheds light on how people with mental illness are often involved in fatal encounters with law enforcement. The report comes from the Treatment Advocacy Center, a nonprofit dedicated to helping the estimated 7.9 million American adults with a severe mental illness. The group says people with these disorders make up 1 in 4 fatal police encounters. The study also estimates 1 in 5 inmates have some form of mental illness and are involved in 1 in 10 of all law enforcement responses. Dr. Ashwin Vasan is the president and CEO of Fountain House, a mental health treatment center in New York City. Dr. Vasan, welcome. Thank you so much for joining us. First off, can you tell us why people with severe mental illness make up a disproportionate amount of those suffering from police violence?
Thanks for having me, Tanya. At the end of the day, serious mental illness and mental health crises are health problems and public health problems. And in the main, in this country, we treat them as law enforcement problems. So it's a complete mismatch of the problem and the solution. And police and law enforcement officers are put in a position to address issues like mental health crises, homelessness, addiction, that they're not well positioned to respond to. And particularly with severe mental illness, when someone is experiencing a crisis episode, their behavior might be erratic and regular de-escalation techniques may not work. And what's required in those moments, those very important minutes, are real mental health professionals who know what they're doing, who have years of experience in caring for people with mental health issues, and who understand the role of medication and therapeutic techniques for what, at the end of the day, is a health problem. So we have to, and the study you just quoted shows very clearly that this is just a part of a systematic problem that we have in this country where we criminalize mental illness. The mental health provider, the number 1 or number 2 mental health provider in every state in the United States is the jail system, the correctional system, and that has to change. And so it's a sad but no surprise that people with mental illness are overrepresented in violent law enforcement encounters and shootings.
And that also sort of overlaps with encounters in communities of color, doesn't it? Because oftentimes, when some of these communities are lower income, there exist even fewer resources in those communities to deal with people or help people with mental illness. Isn't that right?
Yeah, that's exactly right. In New York City alone, there were 18 people with mental illness who were shot by police in the last 5 years, and 16 of those 18 people were people of color, were Black Americans or other people of color. Black people in this country are far less likely than white Americans to get the care that they need. Only about 1 out of every 3 Black Americans with a mental health problem gets the mental health care that they need. And add that to other problems like Black Americans are less likely to be offered evidence-based medication therapy or psychotherapy, and they're more likely to be diagnosed with schizophrenia or more severe and persistent forms of mental illness. When you take those facts together, lack of access to care and higher rates of diagnosis, when you put a criminal lens on something that is ultimately a health problem, it's no surprise that people of color are overrepresented in these fatal shootings, which is incredibly sad.
And I understand that this is a deeply personal issue for all of you at Fountain House. We know that, Deborah Danner, who was a member who suffered from schizophrenia, was shot in 2016 in her Bronx apartment after a neighbor called police complaining that she was acting erratically. So we know it's a personal issue for that. I wish we had time to go into her case because I know it's being re-examined in light of the Black Lives Matter movement. But since we don't have a lot of time, I would love to ask you what your suggestions are for solutions to this problem.
Yeah, we're in the midst of a public conversation that is organized around this phrase, defund the police. I think anyone who is actually looking at this issue carefully and not just falling into the rhetoric, realizes that there are really concrete solutions behind that phrase. And it's not about closing down police, but what it really means is redirecting resources away from jobs, as I mentioned, that law enforcement is ill suited to conduct, which is crisis response and which is interaction with people who have mental illness, homelessness, and addiction, for example. And we have models that work. In Oregon, for example, there's a very successful 30-year model called the CAHOOTS model, which basically takes all behavioral health calls that are not an immediate risk or danger and brings a mental health professional to those scenes. Over 24,000 calls last year in 2019, only 150 of those calls required law enforcement to come in as backup. And that's an incredible statistic and has led to a reduction in police violence towards mentally ill people in Oregon. Here in New York, we support the goals of the Correct Crisis Intervention Today coalition, which is basically advocating for New York City to create a separate line for mental health calls to go to, create a diversion from 911 towards mental health response teams, and to remove the police from services that they are just ill-equipped to provide. That would go an incredibly long way to reducing these rates of very preventable and tragic deaths.
Absolutely, and an unfair burden on the law enforcement agencies. All right, well, Dr. Ashwin Vasan, thank you so much for sharing your insight with us.
Thank you so much for having me.